All right, so infants of diabetic mothers are at risk of what with their heart? Infants of diabetic mothers are at risk of hypertrophic interventricular septums, right? Do most children with transient hypertrophic cardiomyopathy have lifelong issues and require surgery? Nope. That's why I was saying transient so much, right? If it's a transient process, you know it comes and goes for the most part. Most children with transient hypertrophic cardiomyopathy recover without um, surgery for the most part. Patients with infectious mononucleosis, should they avoid contact sports? Yeah. Patients with infectious mononucleosis should definitely avoid contact sports. They should basically avoid high intensity activity as well, right? They should not be outside, sprinting and doing suicides either. They need to take it easy if they want their spleen to be okay. Patients with Mobitz type 2 second degree AV blocks, what do they need? They need a pacemaker. Patients with Mobitz type 2 second degree AV blocks need a pacemaker. Elderly patients with falls should perform what sort of test? That's a generic test. The get up and go test, right? If you're an old person, you're falling a lot, you come into my office, first thing I'm going to do, I'm going to do a history physical. Third thing I'm going to do is get you to do that get up and go test. And beyond that, I'm going to empathize with the patient, right? Empathize with the patients. And if you have a patient that's seeking medication, but you don't think that it is necessary, still empathize with them, but then decline to prescribe a medication, and especially if they're not your patient, right? True or false? Fibroadenomas decrease in size after menses. That's true. Fibroadenomas decrease in size after menses. On the heart, when you're auscultating the heart, what is the best place to listen for a mitral stenosis? It would be the cardiac apex. The cardiac apex is the best place to listen for mitral stenosis. Intention to treat analysis helps preserve the benefits of randomization in a test. Keep that in mind. And keep in mind, too, that communication is key when talking to patients, obviously, right? If a patient has urinary incontinence, you want to see if it is reversible before beginning any intervention. Standardized doses of what sort of holistic medication, not even medication, holistic supplement may help with depression, but also makes oral contraceptives less effective. I'll give you a clue. It's a holy thing, right? St. John's wort may help with depression. If someone comes into your dermatology clinic, they don't have much of a history, they have some super random weird skin conditions. Is it prudent to order a HIV serology? Yeah, yeah, it is. Go ahead and do that HIV workup. HIV presents in a lot of strange ways, so you want to, you know, be diligent about catching it and treating it effectively. Regards to thyrotoxic medications, which one is primarily a teratogen? Is it methimazole or propylthiouracil? Right, it's a methimazole. Methimazole is a teratogenic medication, so propylthiouracil should be used during the first trimester of pregnancy. What is the first line treatment for Raynaud phenomenon? Well, it would be nifedipine or amlodipine, and both of those, sorry, uh, they're calcium antagonists. calcium agonist, right? First line treatment for Raynaud phenomena is a calcium agonist, such as nifedipine or amlodipine. Patients with Raynaud's that also have their random symptoms should receive a workup with ANA, rheumatoid factor, CBC, blood chemistry, and a UA. All right? Don't forget that. What sort of tests should be ordered in a patient with new onset dementia? Obviously, you should order a bunch of things, do history, physical, but the key thing to rule out that's super obvious on tests is a thyroid abnormality. So do your thyroid function tests. What class of medications am I talking about? Donepezil, rivastigmine, and galantamine. Those are acetylcholinesterase inhibitors, right? Donepezil, rivastigmine, and galantamine are acetylcholinesterase inhibitors. And they are first-line pharmacotherapy for dementia-related neurocognitive issues. How long should SSRIs be given following an acute depressive response for the most part? 6 months, right? So if a depressed patient comes to your psychiatric clinic, diagnose them with depression, all things considered, you start them on an SSRI, they come back 6 weeks later, they're like, Doc, it's working. You keep them on that antidepressant for 6 months, okay? What sort of medications are used to treat conjunctivitis? Topical fluoroquinolones are used to treat conjunctivitis. Inflammation of the cornea is what? What's the technical name for that? Keratitis. Inflammation of the cornea is keratitis and is an issue that can arise from bilateral conjunctivitis. A patient with severe eye pain, what sort of physician should be contacted ASAP for the most part under ideal situations? An ophthalmologist, preferably, right? What sort of intervention, lifestyle intervention, is a good initial treatment to help a kid stop bedwetting? Okay, so there are a number of things, but I'll give you a clue. It has to do with waking them up. An enuresis alarm, right? Because you want to wake them up so they can go use the restroom and go back to sleep without having any accidents. True or false? Periodic breathing is physiologic in infants. That's true. Periodic breathing is physiologic in infants. Note, keep this in mind. Relative risk have similar interpretations as hazard ratios. Relative risk has a similar interpretation as a hazard ratio. What sort of medication prophylaxis is needed for meningitis? Starts with a C. Ciprofloxacin, right? Ciprofloxacin prophylaxis is needed for meningitis. What medication is used to treat immune thrombocytopenia? IVIG. IVIG is used to treat immune thrombocytopenia. Patients with cocaine intoxication may need what sort of intervention? A percutaneous coronary intervention. So we know cocaine can cause a heart attack, right? If you're in the ER on your little rotation and you see some dude jacked out of his mind talking about stocks or whatever, he's having a heart attack. He's clutching his chest. He's like 28 years old. EKG shows a STEMI. Go ahead and get that PCI enacted, that percutaneous coronary intervention. What sort of, so there are many things, but what is the, all right, so how about this? Skin tags on a person, are they associated with glucagon resistance or insulin resistance. You're associated with insulin resistance. What is the typical organism, or virus, I should say, that's the cause of diarrhea on cruise ships? Norovirus, right? Norovirus is the typical diarrhea bug on cruise ships. Does amiodarone affect thyroid metabolism? Yes, it does. Thyroid metabolism is affected by amiodarone. So, with that in mind, do you want to get repeat thyroid tests for a patient that's on amiodarone? Yes. You want to get a repeat thyroid test for a patient that's on amiodarone. What are the four main ways that diabetes mellitus is diagnosed? All right, so I'm going to say the test, and you tell me the value. Hemoglobin A1C, greater than or equal to 6.5%. Fasting blood glucose, greater than or equal to 126 milligrams per deciliter. Random glucose, greater than or equal to 200. OGGT, oral glucose, um, oral glucose, OGTT, oral glucose tolerance test, greater than or equal to 200 milligrams per deciliter. So those numbers, 6.5, 126, 200, 200. 200 for OGTT and a random glucose test. If it's over 200, got diabetes. Fasting blood glucose, 126, and then hemoglobin A1C, your standard go-to, is 6.5. Toxic megacolon with workup requires what? Imaging. What? Yeah, an X-ray. Toxic megacolon requires an X-ray. What are the first-line treatments for, I guess, toxic megacolon? Would it be glucocorticoids? Check into that. But it would be glucocorticoids for a sort of metastasis that's impacting your nervous system, especially in like the brain or spinal column. So you know your cranial nerves. This is old school. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Do you know what they are? Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulococcular, glossopharyngeal, vagus, accessory, and hypoglossal, right? Obviously know their lesions, and the brainstem lesions, Wallenberg, and all that. What main issue does kava kava supplementation cause? It causes liver issues, right? Kava kava can cause liver issues. What is a common complication of C-sections with the newborn? Transient tachypnea, right? Transient tachypnea of the newborn is a common complication of C-sections. Babies with hearing issues should have what sort of test? Audiology, obviously. And what is a disease in South America, hint, hint, that is due to a protozoan? Chagas disease. Can you name the bug? Trypanosoma cruzi.